Guys, it's Christina. This video is for any of you who are pregnant and are wondering, can I work out? I looked up on the American Congress of Obstetricians and Gynecologists, and if you want to go there, you can. It's acog.org. So, real quick. If you have a healthy pregnancy, so that means you don't have any underlying issues, like you don't already have heart disease or lung disease or cervical insufficiency. If you're pregnant with multiples, you might have higher risk factors, and the doctor may not want you to work out, which, that's completely fine. If you have placenta previa after 26 weeks, preeclampsia or severe anemia, those will be things that your doctor's going to look at and say, you can either do this or not at all or whatever. So just check with your doctor, of course. Get the okay. Some things that are going to be affected by pregnancy with working out, it's going to be your joints, balance, and breathing. So when I say joints, you have these hormones that make everything looser, preparing your body for labor. All right, so everything, and especially the more pregnancies you have, the sooner this starts to happen. So keeping a good workout regimen, trying to get everything still tight, will help you tremendously. If you're having hip pain, back pain, just uncomfortable, keeping active, exercising, these things are going to be alleviated tremendously by exercising. Balance, of course, your stomach is growing. You're going to have more weight in your front. So in some of the exercises, you may not be able to do anymore. You just have to modify it. And of course, you're going to need to listen to your own body. If you're not coordinated, the key is you don't want to injure yourself or your baby. So if you're not coordinated, make sure you're holding on to something, a chair, the wall, whatever, so you prevent things like that from happening. And the last thing, breathing. Of course, whenever you get bigger, that baby is taking up more room. The uterus is, of course, growing, so you're going to have all of your insides just pushing on that diaphragm, which is going to be harder for you to breathe. You're going to have more blood flow, so your heart is going to be working harder. And I want to make sure you do, I'm going to stress this, keep yourself hydrated. Like the first trimester, really the worry is like overheating. And it used to be a huge thing about your heart rate, to keep it under a certain amount. It used to be like 140, I think. But now, if you're like me, someone who has been working out previous to it, it's really not that much of a concern. You can, continue to work out how you were before within reason. So these are going to be reasons to stop, okay? Say if you have any bleeding or spotting, if you feel dizzy or faint, if you have chest pain, headache, say you have muscle weakness, you're doing something and it just, obviously you're just completely can't do it. That would be an area of concern. If you get calf pain and swelling, you'd want to stop. contractions. Okay, every once in a while, if you get, contractions, they could be Braxton Hicks. It's not regular, but that would be something that's normal. What's not normal is regular painful contractions. Okay, that is something you need to stop right away. And then also, if you're having like fluid just leaking, it could be your water breaking. So those would be reasons to stop and let your doctor know about that. And then for the rule of thumb, when it comes to your heart rate, I'm going to give you this advice, and I believe this is on the website too. If you can talk through but not sing, that should be your, I guess, guide. You don't want to, overdo it. Just make sure you're listening to your body. And like I said, if you can talk through it, you're good. If you can't sing, that's where you should be. You're going to get sweaty, and you should, keep that heart rate up every so often. Make sure you stay hydrated. That's one thing dehydration can cause, like aches and pains, in your back, and keep your muscles tense and everything. So be sure you take plenty of breaks, drink plenty of water, and that's what I got for you today. If you have any questions, go ahead and leave me a comment. But like I said, talk with your doctor, make sure it's okay. But that's kind of the rule of thumb. If you haven't been able to see your doctor, that's kind of the rule of thumb. That's on the acog.org website. So hopefully that makes you feel better. And I guess this next time I'll be posting, hopefully, a workout video. And like I said, like, comment, share, and I will talk to you soon. Have a good day. Peace.